seconds, huh?
Yes.
Yeah, so I'll tell you that we are live at that time. Yeah. We are live.
You can start. You're starting.
Good evening and welcome to IPA Colloquium on Innovative Technologies and Applications. Let me take a brief moment here to introduce IPA to you. Let me, please permit me to share my screen. Yeah, so the Indian Physics Association was founded in 1970 to help the advancement, dissemination and application of knowledge of physics. This is achieved through publication of various bulletins, newsletters and by arranging seminars and special programs, lectures for students, teachers and young researchers. IPA runs special lecture series, DIE CV Raman lecture series. We hold 5 lectures a year. There's also IPA IOP Bhabha Cockcroft Walton Exchange lectures, where alternately a speaker from India goes to UK and speaker from UK comes to India. In India, these lectures are known as Cockcroft Walton lectures, and in UK they are known as Bhabha lectures. There are Professor P.A. Pandya Endowment Lecture. Again, annually we hold a lecture. IPA also partners and sponsors various conferences. Recently, we concluded a New Horizons in Physics IPA 50 series in commemoration of 50 years of IPA. These lectures are available on YouTube. This lecture series ran for 6 months, and every Saturday we had a lecture. IPA gives awards for recognition of senior and young scientists. It also liaises with national and international societies like APS, American Physical Society, IOP UK, and AAPPS, that is the Association of Asia Pacific Physical Societies, and so on. We will be soon starting from the 2022 Hema Ramachandran Lectureship Award, which is again specifically meant for applicable technologies, innovation which is going beyond the boundaries of science, in memory of renowned scientist Hema Ramachandran, who passed away last year. Here you see the activities of the IPA, kind of pan-India with different chapters, and with the pandemic turning out these challenges into opportunities. With the webinar series, we have been able to reach to different parts of the country. The current office bearers of the IPA are here. Professor Ramakrishnan, Director TIFR, is the President. Professor Tanushree Sahadas Gupta, who is Acting Director of SN Bose Institute, is the Vice President. Myself, Vandana Nanal, General Secretary. I'm a nuclear physicist. Professor Samit Mandal from Delhi University as the Joint Secretary. Dr. Aradhana Srivastava from BRC is Treasurer. And Professor Shubhati Goswami is the Chair of IPA Gender in Physics Working Group. This current series of the Innovative Technology and Applications was actually started at instigation of Dr. Jagtap, who is in audience today, and I'm very happy about it. So this is the idea behind this series, is to look beyond the basic research and introduce to young students the avenues which are open to them for, in addition to the research, as well as highlight and emphasize the applications of the basic science in the different aspects of life. We have had 3 lectures so far in this series, and all the lectures are available on the IPA YouTube channel. In the IPA webpage address, which I will type in chat box, you can go and see the links. Today we are going to have a lecture from Dr. Rachna Dave, who is founder and CEO of Microgo. At present, IPA is also partnering in a science series, which is a popular lecture series run for school students by UPES Dehradun in association with IOP UK, IPA and IAPT. Details about this also can be found on our website. So without further ado, I will now request Dr. Madhurima to take over, and we are thankful to Central University Tamil Nadu for hosting this lecture. Thank you.
Thank you, Vandana. On behalf of IPA, the Central University of Tamil Nadu, and on my own personal behalf, I extend a warm welcome to all of you to this colloquium, which would be talking about innovative technology and applications from somebody who has a great idea, Rachna Dave. So before I speak more about the speaker and go on to the talk, I would request the head of the Department of Physics at Central University of Tamil Nadu to give a brief about the department to all of you. Professor Kavita Lewis, who is the head of the department. Ma'am.
Good evening to all. So, respected Madam Professor Vandana Nanal, General Secretary of the celebrated Indian Physics Association, Professor Jagdap, the brainchild of this event, Professor Vivek, the speaker of today's colloquium, Dr. Rachna Dave, the founder and CEO of MicroGo, Professor Madhurima, professors, colleagues, research scholars, students and delegates and dignitaries. Again, warm good evening to all and a warm welcome to this colloquium on IPA event. So at the outset, I would like to thank the Indian Physics Association for giving this wonderful opportunity for hosting this event. And I record my sincere thanks to IPA on behalf of the Department of Physics, Central University of Tamil Nadu. And it's my pleasant duty to explore our department at a glance. From the year of its inception at 2010, the department offered the integrated master's program in physics and PhD programs, the cutting edge areas of physics. So many of our IMSc students are pursuing their PhD in the reputed national and international institutes, including USA and Europe. So the department, with its 10 faculty, has executed 13 research projects so far, both from national and international agencies, and has ongoing projects to the tune of 100 lakhs. As a result, the department has published more than 170 research papers in this decade in the journals of high repute. The department has filed 5 patents with 1 patent granted. Presently, the department is hosting 34 research scholars towards their PhD programs and 5 doctoral students under UGC Kothari Fellowship itself. So in the span of a decade, the department has graduated 8 PhD students and 4 more awaiting for their viva examination. So with these few words, so let me once again thank the IPA and Professor Madhurima for her efforts to make this event a possible and successful one. Thank you one and all. Thank you very much.
Thank you, Professor Kavita, for that brief introduction to the department. Now it's my pleasure to be introducing the speaker of today's talk, Dr. Rachna Dave. She is a trained microbiologist by profession. Dr. Rachna Dave has vast experience in developing R&D-based technological solutions. After completing her doctoral studies at NYU in USA in 2008, she returned to India to work as a fast-track young scientist. She joined as staff scientist at the prestigious Bhabha Atomic Research Center, BARC, in 2008. She received the Department of Atomic Energy, Government of India 2012 Young Applied Technologist Award for her contribution in BAE towards societal benefits. She quit her position in BARC in 2016 and established MicroGo, about which she'll be speaking in today's talk. She is a recipient of various awards, including the recent COVID Warrior Award from IKP Knowledge Park, Hyderabad, and Biotech Product and Process Development and Commercialization Awards from the Department of Biotechnology, Government of India, for the year 2019. MicroGo works on enabling the power microswachhata by prevention technologies. They had recently showcased their innovation to the Honorable Prime Minister of India at the Prarambh Summit. And we are all extremely excited to hear more about all this and how you have shifted from being a researcher to being an entrepreneur, Dr. Rachna. The floor is yours.
Thank you. Thank you, IPA, Vandana, Madhurima, Professor Kavita, and the Department of Physics, CUTN, for inviting me here. I must thank Dr. Jagtap, right? I must introduce the audience how Dr. Jagtap and I know each other. Dr. Jagtap was the director of the chemistry group at BRC, where I was stationed. And each time Dr. Jagtap used to come to Kalpakkam, that's where I was working from Bombay, I would eagerly wait to hear his ideas, his thoughts. Because every time he would come, I remember he would sit in the corner of the table, and every time he'll come up and tell us something new, we would be so excited. And today, actually, it's a privilege that he actually, told IPA that maybe Rachna could come and give this lecture. And I'm extremely honored that, he thought that I can contribute here. I'm sure at this moment, Dr. Jagtap is thinking and telling in his mind that Rachna, bas band karo and aage badho. But I must thank you for this opportunity. So why students, I presume most of us, the students, for the benefit of the students is why this colloquium has been, is been held today. And while we were speaking, Vandana, Madhurima and I, we were thinking that what is one essence that we want to bring out from this colloquium? That essence is that PhD, once we all are pursuing the scientific science as our graduation or post graduation, or even after PhD, we should not be restricting ourselves that we are going to become have a scientific career or try and get a position in teaching or a researcher. But entrepreneurship is something that is actually available for the science graduates or postgraduates or PhD holders. And that's something that we should think as also one of the career prospect, right? Now, that's the entire idea of what I'm trying to do today. And there are three disclaimers by which I'd like to start the presentation or start the talk, in fact. There are three, I call it disclaimers, or are these myth busters, right? That they actually exist or don't exist, but these are my point of views, right? One, entrepreneurship is a way of life. It is not a 9 to 5:30 job. It is way of life 24/7, 365 days. In fact, most of the people in India live like that. Possibly we, coming from science background, for us, it is, these days we come up with these bigger words like startups and, these are very fancy words, but frankly, lots of people in India, actually, it's for them, it's like way of life. That's how it is. This is how they earn their daily bread, or they run companies, and there is nothing big deal about it. But it is not, if you are fixated to leading a life that you will start at one particular time and end your day at a particular time, at least in your initial years, it's not going to be like that. It is going to be 365 days, 24/7. Disclaimer number two, entrepreneurship, even though we have the other word to this is called business, but it is not a path of making money. If you want to choose entrepreneurship as this common notion, there's a lot of money in here, or that's what my objective is, please don't think like that. That's absolutely not the way of, entrepreneurship doesn't lead you there. Entrepreneurship is a way of solving a problem. The money that you earn or the revenues that you earn is actually a byproduct. Solving the problem is your fundamental goal when somebody takes up entrepreneurship. So earning money is important because at the end of the month, you are responsible for the rentals, you are responsible for salaries, you are responsible for so many things. But if you start only looking at the problem, the byproduct keeps on, coming automatically. The third point, you have a great idea. And if you think that, yes, I have a great idea and this will lead my entrepreneurship journey or my enterprise a success, that is also wrong. Ideas actually are, frankly, it's my personal opinion, and I'm sure most of you would have heard it also if you are keen into entrepreneurship, that ideas after some point of time, they don't matter. What matters is how you execute those ideas, how you actually turn it into a successful business such that people are actually buying your product? How you are innovating yourself? How are you reaching out to the customers? How are you pivoting? How are you changing? How are you understanding the customers? How are you understanding your competitors? How are you understanding the landscape? How are you dealing with your team? How are you motivating your team in the initial years when you're not paying them as much as possibly the industry? But these are all facets of entrepreneurship. So great idea, yes, but after that, if your business or your entrepreneur or your enterprise is going to be a success or not, a lot of factors that remain, and execution of that is what will define whether your idea actually worked or not, right? So while we have busted these three myths or this three disclaimers, I'd like to start. How did I go? I mean, I've divided my entire 12, 13 years of my life into three phases. And I'll tell you, possibly this is why I have envisioned that how from one to other to the third, and how did I reach here. Before that, let's understand the product development phase, right? Even a product development has a phases. You have an idea, then from idea, you usually go out and talk to people that, hey, I have this thing. Do you think that this is a pressing problem for you? If I solve this problem, will you actually pay money to buy this thing? So that is point number one. Once out of 100 people, let's say 70 people tell you that, yes, this does look to me a problem and I will pay you money if you solve this. That's an idea you want to work on. See, when we are in research and we write research papers, you know how our introductions are? Our introductions are usually taken from the articles, or we cite citations where people actually have discussed the same idea, same problem. But frankly, those problems do not always stand true in the actual scenarios. Actual scenarios, there are lots of things that actually help you to shape that entire thing. I'll share you this example of ours. In 2016, when we started the company, we had an idea that we will solve this problem of water disinfection. And I was already, working in DRC with some of the water related issues, and water has been the passion project. So while we were working with this one customer, and then I went and asked him that I understand that this is a problem, and do you still face this problem in your company while you're treating water? He said, yes, we have this problem. And I told him that I'm developing this technology which has this, and I have a great idea, great product and all that. And he said, okay, how much will I be paying for this? And I told him something, I remember it was something around 1 rupee a liter. So that entire treatment of the cost will cost you 1 rupee per liter. I remember listening to that person whom I respect him immensely, because he gave me my first lesson of entrepreneurship. That what are you even talking? Have you done the dynamics of the water treatment? How so many factors are involved? If we are trying to sell at 1 rupee a liter, disinfection is absolutely a minuscule part, but an important part of the entire process. And we deliberated. I didn't give up on him. I kept working on that idea, and finally we came at such a fraction of the cost, which obviously elevated their product, but also helped us to understand that, hey, I had a greater idea, but I didn't work on the costing part. If I don't make the product at that particular cost, who is gonna buy me? And if that product increases the cost for that particular customer, how is he gonna sell it, right? So see, there was an idea, but if I had not executed that well, or if that gentleman would not have advised me, I don't think we would have seen success in that product. So coming back to the stages of the product, you had an idea, you talked to some of the customers. Out of the survey that you do for 100 people, from there you choose some of the customers who actually show more keen interest, right? You constantly engage with them, right? That this is what I've done. And some of them will be very kind enough to give you more insights, possibly ask you to come to their facility, show them the place, and tell them that, see, this is the real issues. Possibly they'll also give you more problems to solve, right? So then you go back to the lab and create a prototype. Prototype is something that is functional, solving that problem, but it is not nice looking, doesn't even look like a product. It's very ugly looking. Most of the first prototypes are, but they solve that problem. You go back to the customer. By now, that customers are now your anchor customers. Basically, they're anchoring you. Yeah, they're ensuring you that you are on the right track. Then you go back to these anchor customers, work with them. They tell you, no, these are the issues that you need to solve. You go back, again do it. So couple of prototypings happen. By the time your third prototype has come, you possibly are working with 10 more anchor customers, right? After the third trial is possibly you start working on the pre-production prototype, and you work on your economics, your costing and your pricing and all of that. And that's when you actually bring the product. And of course, there are regulations involved if it's a biotech product and all that. So that's when you bring out the market into the product, right? So it has phases. Similarly, I have categorized my journey in phases. Pre-industry, pre-industry part 2, and then how did I become the industry myself? So I think I never actually understood or possibly appreciated basic science much, because I never understood. For me, any science, if it is not built into a product, I have never understood that logic. Possibly I don't have that understanding towards that. Not that I don't appreciate basic sciences, absolutely yes, but I was always on that side that applied what interests me. So I was in 2005, I started my PhD at the Sardar Patel University at Vallabh Vidyanagar. My guide was Dr. Datta Madambar. Dr. Madambar's lab had both basic sciences and applied sciences. So we had this thing that, first 3-4 months, you just try and see around and see what interests you. Although partially it is decided what you're going to work, but he does give you that freedom to try and see that this is actually what you want, rather than he choosing and giving a project for you. So I was looking around and doing things, and that's where they had a very great project on esters, right? Those flavors that we make, right? Ethyl acetate and stuff like that. So they used to make those esters for industry, and it was enzymatic in nature. They used to produce by enzymes. That's when we used to, had a couple of times we had interacted with the industry. So when they would come and they would see the product and evaluate the research in a manner was so different than how you would evaluate the research while you're writing the research papers. There was drastic change. Here they're talking about numbers, they're talking about shelf life, they're talking about how long it will stay at your place, how will it stay at distributor, dealer, and then, those things, storage, and those things that they're talking. They're talking about how to reduce the cost of productions and stuff like that. That definitely was extremely exciting to me, rather than the, how to possibly get a greater microbe, or something like that, which can produce better enzymes to produce esters or stuff like that. So that was my first engagement with the industry. Within a span of, I believe, 8-9 months, where I had almost, started working towards the ester project, we received a molecule from our collaborator in the US with Dr. Madambar's lab, and this molecule was sent to us to, try and find out some more applications for this, right? Now, I was a 6 to 7 month old, PhD student. Now, most of you, if you know how a research lab works, like, there's a lot of decorum there. Senior researcher, somebody who is writing the thesis is respected the most. Then somebody who's doing it early phase, late phase, and people like me have just entered, right? And so we had this coffee table where professor will come morning, evening, and we'll discuss about our daily plans and stuff. And that particular packet, I still remember, it was yellow in color, and it is just sitting right in the coffee table. Now I am the newest one. Obviously, I have less work than all these people. They're trying to finish it. They're worried about the papers, getting accepted in particular journals and all of that. And I obviously have less work to do because I'm still trying to figure it out. So there is this yellow powder that has been kept there. And I'm like looking at it, and every time sir comes, he has seen, he discusses, he looks at the powder, gives a grin on his face and leaves. This happens for almost 2 weeks, right? At the end of the 2 weeks, sir says that, yeah, nobody is interested in this. And all our senior researchers, they were like, sir, whatever, I don't remember exactly those days, but nobody obviously wants to take it up. Obvious reasons, they are already overloaded with their work. And I'm like, sir, can I take it? He's like, but you just come, will you be able to handle a new molecule? I'm sure in his heart he is thinking, you have not even hatched and you want to take up a project like this. But I guess since there was nobody around, he must have thought that, chalo koi baat nahi, let her explore and we'll see what happens. And I started exploring the applications of this particular product and tried lots of things. And within, I believe, 6 to 7 months, we really started getting great results, right? Something that our collaborator also possibly did not expect, that we can actually do all these things with this particular compound. And I believe that's when we were presenting our results, and Professor Ross, he told that, why don't you let Rachna come to, NYU, and maybe possibly she can, work here at a greater pace. And that's when, Professor Datta Madamar kindly agreed, and he allowed me to, go to the US and start working there. Now I go there, I go there and I start working on this. And I also start looking further fascinating area of work that that lab was doing was in drug delivery. Now, every day, or not every day, possibly every week, or they had this monthly meetings where industry giants like J&J, Dow, they used to come and visit these labs, right? Now, that was this esters, which are the smaller companies. Now here, this bigger giants, they come and they talk about, different level altogether. Most of us are here from Tamil Nadu, you will realize what I mean, very level talk, right? It's like different level of commercialization has been talked about. And I mean, they are trying to find out what all not can be done with this particular project. And I get excited. I'm still in the early phase of my PhD, so I could, try and explore more. And that was a chance that I was taking to extend or try to find a problem to solve. And though as good for me that everything was in connection, so I go to Professor Gross and tell him that, can I actually also work in that project? He's looking at me, he said, no, you have come for that, you have to do this. And I tell him, sir, that is also extremely interesting to me. He says, but you are only one, right? How can you be working on 2 projects? Now I'm equally excited for both. I tell him, can I work day and night? He says, what's up? You don't have life or what? I'm like, I've come to do the maximum out here, right? And you're young, and obviously you want to, do everything possible. And when he says that, and I'm like, he says, okay, fine, you can balance your times and you can actually do it. And so that's how me and there was one another colleague of mine, we started working together. So we'll kind of do day and night, day this, night that, and in between our HPLCs and GCs, we will try and do that other product. And that's when, after a year, that product started to click so well that, we patented it, and then J&J came and they licensed it and all of that. And we started using it for brain tumors and all of that. So I finished my PhD, I come back to India. So that is my exposure of industry. And, just by talking to the industry, this is where the industry is actually buying the technology. Of course, it was not completed. It was in the clinical trial, but kind of talking to the industry. Coming back to India, I joined the Bhabha Atomic Research Center at Kalpakkam, where we started working on biofilm control, right? So because that place works on biofilm and biofouling, the place where I was working, water and steam chemistry division. And that's when I start working towards the catheter infection, right? So now imagine, what is a catheter? It is a small tube, right? Which is, when the patient is not able to go to relieve himself on his feet, that's when the catheter is being used. Catheter infection is a huge problem, right? You would have catheter ke baad, it's very common, not very common, if not care has been taken, UTI is obviously a common problem there. And before I wanted to go to this bigger tunnels that we have in, power plants where the water has been drawn in, right? So that's when you actually draw a lot of water, and the velocity at with the flow rate at which the water flows is extremely high. I didn't want to immediately jump on that, because if I'm solving that problem, then only I am actually in service to the Department of Atomic Energy, right? Because that's a huge problem. But I didn't immediately want to jump there. I wanted to work something on the very small level, try to establish, and slowly move towards and achieve that bigger role that they have. So I started working on catheter infection control and all of that. So we were exploring a lot of molecules, the active reagents, to find out that which molecule actually we can use for the infection control. We did start with antibiotics, and initially we started moving towards other bioactive agents, and we were looking some of the compounds, and we found nitrogen oxides was something that had a great potential. It was bioactive in nature. It has a lot of other activities. I mean, it has a lot of other potential applications. And those days, BRC was extensively working on societal applications, and dressings were something that we had actually contributed immensely, to the people of the India. So, so there was no bioactive dress. I mean, dressing based on biomolecule, bioactive agent, which actually aids the healing from the surface was available. And I chanced upon this nitrogen oxides, and I started working towards this. While I'm telling you this, please understand what is objective. You have to reach to a very far path, but that distance is a larger distance to cover. Possibly it will take 10 years. But I'm an applied scientist, right? If I develop a technology after 10 years, I have absolutely no motivation to work. When we are basic researchers, we get motivated when our paper comes with, impact factor, this. But for an applied scientist, the product is what motivates them. Even patent, for that matter, doesn't motivate. Even if the patent is granted, it doesn't motivate. The motivation comes only when you see the product launched into the market or somebody using that product. I believe that's the single most motivation for any applied scientist. So while I'm trying to achieve the biofouling control, I am trying to do small things. So we did the catheter. Then we started working towards, these are called offshoots of your actual project, right? Then we are starting to explore the nitrogen oxides. And I believe within quite I think 1.3 or 1.4 years, we actually had a very beautiful product, first in India coming out. And obviously we patented it. We did a technology transfer. We basically licensed the technology to a company in Tamil Nadu, right? So that we started. Then we had one more product which we licensed the technology in a company in Delhi. By that time, I've reached to 2015, where my interaction with the industry has become very deep. Now I am the one who's talking about the technologies and how we will license it and what will be the price. And our department had a great cell which would actually help us to evaluate this on a different level. They were very experienced. So that really helped me to be more, that increased my passion, or possibly helped me realize what actually is my passion and how am I supposed to achieve that. And I think by the time we have reached 2015-ish, or maybe almost 2016, is when I realized that if I actually have to, work at a space that I wanted, because see, technologies work at a very faster level. Your versions 1, 2, 3, 4, they come within a year. After 5, 6 years, that technology is old and you need to come up with a newer technology, which actually is relevant for so many reasons, right? So I think, and then at the same time, if you had 2016, the ecosystem was amazing. The entrepreneurship was really given a lot of values. India was looking at a time where, we were talking a lot about how this new age entrepreneurs can actually change the face of our country and what are the problems. And I always believed, while my interaction, during my time in BRC and previously when I was in Vidyanagar, that most of the problems, the solutions, the products that we have, they were all borrowed from the Western countries and were being utilized or been implemented. They never understood the problems that in dealing with the product, the kind of diversity we have, the kind of values we have. There's so many. They're so diverse, right? So nobody had ever, especially in infection control and stuff like that, nobody had actually developed something keeping all these things into mind, keeping the future in mind, because imagine so many people using some chemical for, let's say, disinfection, right? What is happening to our ground level? What is happening? I mean, all of you know, every other person will complain about the TDS in our water, right? If we start taking things where we have a very limited amount of land and we have so many people thinking differently, talking differently, we need to really start thinking on our own lines. And somewhere between 2016, I came across a great article, which was talking about the pandemic, the Spanish flu, and how global travel will impact infectious diseases will change. And during the times when my son was born in 2010, I could start seeing the problem around common touch points, possibly because I was a young mother and I was really concerned about him touching it. And possibly I was seeing bacteria everywhere with my naked eye. Not true, but I'm a mother. I can look everything when when the child is young. So that led, of course, the ecosystem and all of it, and of course my enthusiasm always went to a different level when I was interacting with industry. 2016 is when I thought that this is the time to become industry myself. And I remember writing to Dr. Jagtap that I'm going to resign, and of course we did all that, and I resigned from my position as scientist from IPA Atomic Research Center with heavy heart, obviously, because it is a great institution to work in, and had contingency plan in a manner that I did save some money, because I knew that for the next possibly 3 to 4 years, cash will be tight. We had a family and all those things were there. So I had saved some money to ensure that our, living standards are not compromised. And 2016 is when I started my company in Chennai, and the name of the company is called Microgo, which is there on the poster. At Microgo, what we do is, at Microgo, we work on the prevention. Okay, prevention around hygiene, right? And if you look at my LinkedIn introduction, it still talks about global travel, infectious diseases, and climate change. These three things will be detrimental to the way we live in, and we need various technological solutions that solve problem around infectious diseases, leading to the leading to the problems that we usually see. And COVID-19 is a fine example. I must add here that every year I wanted to change that introduction, right? Because I feel like, hey, you're trying to work on infectious diseases, which is spreading by global travel. I mean, obviously, nobody saw COVID-19 coming, right? But not that I wanted to prove the entire objective, the idea of Microgo by COVID-19 to happen. No, absolutely not. But when COVID-19 came in, we were ready. We were ready to serve the nation. We were not completely ready, because in 2020, we had just finished our piloting, the third pilot with for all our anchor customers, and we were just ready for commercialization when COVID-19 striked. But, as an entrepreneur, I think only one definition defines entrepreneur, that they figure it out. Whatever happens, they kind of figure it out. The problems do come. They don't consider problems as problem. They just consider as a milestone to be, covered. And then they just keep going. For any entrepreneur, nahi hoga, this will not happen. It doesn't come into a dictionary. And I believe that is the single most trait. If any one of you are actually really wanting to take up entrepreneurship, please ensure that that is your first stigma. That do I give up? If you don't give up, you are at the right place, and you will actually, even if your idea is mediocre, you will be able to execute greatly and bring your enterprise into success. So that's where what we did was we actually, I had a great team to work with, right? So we came back overnight. I told them that, look, we have to make so many machines. Can we do it? And somehow the team managed, and we kind of, did, and start deploying our machines, our solutions last year to various places. We have touched around, in the last year itself, 70 lakh plus people with our different innovations. And so let me tell you what do we do, right? So at MicroGo, we enable the power of micro swachhta. Now, what is micro swachhta, right? If you have heard you've heard about our Prime Minister talking about Swachh Bharat, right? Clean India. Our Prime Minister talks about the litter or the trash that you see on the streets. That is the trash that you can see. We at MicroGo work on the trash that you can't see. Those are bacteria, viruses, possibly some fungus, that's our area. And we work on only 3 essentials of human lives where these microbes impact, which is water, food, and healthcare. We believe these are the only 3 essentials, if are not served properly, will impact you and me, for years to come. So these are the only 3 places where we kind of try and work, with obviously hygiene and prevention being our center focal point. Now, when we started with our idea that this is what we were going to do, we were working on common touch points like door knobs, door handles, which obviously stands extremely relevant in the COVID-19 situation, right? And when we started working towards it, we only thought that infection control or microbial control or antimicrobial solutions will help us to have the trajectory we wanted. But that itself is enough for our customers liking our product. And that's where what I keep telling about you, and I've mentioned this quite a bit of times, the importance of anchor customers comes in. They actually tell you, yes, what you're building is good, but what I want is, this. When you're actually creating any solutions for your customers, you don't only create solutions that help them to solve their problem. You actually also start looking at how your solution will help your customers in their businesses, especially because we work in B2B. Our businesses serve other businesses. We don't directly serve the customers. So if you're going to Nilgiris, and you will not see our products because we don't serve B2C. We only serve businesses, right? And when you're interacting with customers, you'll realize that not only solving that problem, but how your problem will help them run their businesses more efficiently is something that is a great value proposition for the customers. You actually create value. It should not be just adding value. If your product is just adding a value, it will not take that leapfrog. But if it is creating a value for the customer, that's when you have actually nailed, the problem. So coming back to what was our first intention, keeping life safe by infection control, microbial control, was we were doing. That's when our customers told me, hey, the other problem when we look at hygiene is non-compliance. Now you may ask why, why are we talking about, you are talking about infection control. How can you not listen? How can you be non-compliant when it comes to hygiene? Please understand, while you were targeting micro swachhta, your problem is those invisible microbes, right? When you are trying to solve a problem around something which you can't see, right? You can't see microbes by naked eye. And if you tell somebody that, hey, you have to ensure that you have to wash hands 10 times a day, or you have to clean according to this, you have to maintain this hygiene protocol. You're like, madam, I can't see only. If I don't see, that means it's not there. And when you start selling something on something that you don't see, it is looked upon as an expenditure, or what in Tamil we call it as a sellable, right? It is a sellable for them, that because they're not able to see the problem, right? That's when we started working around in around 2018ish, where we realized that, hey, look, we will not only solve the problem of our customers for creating anti-infectious solutions, but we will also ensure that we help them. We will also ensure that our solutions actually are as an investment for our customers. What we call it as a mudalidu. Yes, I've taken it from a friend of mine. So mudalidu, it should not be sellable. It should be an mudalidu, or it should not be an expense. It should feel like an investment for them. So now our customers are actually our products are now helping the customers boost their bottom lines, right? So now they are actually helping them also bring in more sustainability, because everything that we work on, we also ensure that we don't build our product for today or tomorrow. We build for our products for our generations also. 10 years down the line, if my product has to remain relevant, it must bring in sustainability, because we are sitting on a time bomb, right? A bomb which will explode anywhere. We have, look, because of climate change, you see the kind of erratic rains we have. Someplace we don't have, somewhere we have flash floods. There are lots of, this micro things is impacting 10 years down the line. And that's where we have brought in an important factor, which we call it as a sustainability. So what we do is, point number, we keep life safe by bringing infection control, microbial control, or hygiene technologies. Second, we do is we ensure that our products boost bottom lines, or they bring in sustainability for our customers. This is something that we were doing till 2018. In 2019, interestingly, some of our customers started to hint us that we are doing all this. But since again the problem of invisibility stays, because even though these protocols are placed, we are never able to know whether it is working, who is doing it. I have a big staff of 100 people. I mean, my customers, some customers have a larger staff, and they are not able to understand whether these products are actually helping them. And if they are helping them, are they helping them to any extent? And there was absolutely no digitalization in hygiene, except in some of the other areas where washing is there, or where, the laundry is there. Otherwise, hygiene absolutely had no digital, right? You can't tell them that if these are the SOPs that these companies are, this hospital or this food industry has to follow. They were never able to come to know whether these SOPs are being followed, and are they even working or not. And that's when we added the third point onto our triangle, which make it now complete, which is called digital hygiene. So now this is where we stopped and we said, hey, look, now we are not going to expand. We are going to work on these three fundamentals, which we call it as our pillars at Microbe. Any product development that we do, we ensure they must keep life safe by infection control, or any antimicrobial solutions. They must save valuable resources for our customers, and we must be able to digitalize hygiene for real-time monitoring. And we actually only talk in numbers: 98%, 99%, 85%. So once it has gone below the acceptable limit, immediately the customer knows now the time has come to take action. Right? So this is exactly what we do at Microbe. During COVID-19, we had this great opportunity to serve the nation, and we as a team are extremely, if you look at our logo, it is saffron, white and green. From day zero, we have been extremely nationalist. We just wanted to serve the nation, and that's exactly what is depicted on our logo as well. And COVID-19, in fact, proved us that, gave us that opportunity to serve the nation. This year, we have taken another leap. We have directly started serving to the ICUs now. We work at the hospitals at the infection control level to where it actually matters, where at the critical care. And, 2 days back, it was National Doctors Day, and we did a very big tribute to the doctors by commissioning at a at a very big hospital in Delhi. And so that's about it. So I'll just talk about the 3 myths that I told you. 1, entrepreneurship is way of life, 24/7, 365 days, at least in the initial years, possibly. It's not a path to make money. It is a path to solve the problem. The money or the revenue that comes with it is a byproduct. If you're working on a greater problem, if your problem is really serving a lot of people, it's a problem for a lot of people, the money automatically flows. So that's there. 3rd, you have a greater idea, super. But how do you execute that idea is what will make the difference. And 4th, as I said, at entrepreneurs, if you're an entrepreneur, your first trait is you have to figure it out. You will figure it out. So you don't see problems. You just see that as a milestone which you have to cross, and you keep moving forward. So I think with this, I'll close, and I think I'll be very happy to take questions. Madhurima?
Thank you very much, Rachna, for that very interesting talk about your journey, because I think like we were discussing even previously with Vandana, whenever a scholar joins for a PhD program, we have this mindset that the only path is academics.
Yes.
And rarely do we think that, or, go join somebody else's company. Entrepreneurship is not something that comes naturally to one's mind.
Yes.
So yeah, there are a few questions that I've got directly. If there's anybody else who would like to ask a question, you can please type it in the chat box, or if you want to ask directly, maybe raise your hand. How big is this venture of yours, both in terms of the finances and in terms of your team? Like you said you have a team. How big is this team?
So we have around 30 people here. We have 19 people working as a directly, and we have another 11 people working in different capacities. Apart from that, we do take services from other service engineers who may be not on our payroll, but obviously we keep taking their services for smaller issues around the world because we serve pan-India. When the COVID-19 opportunity came in, we were not doing pan-India, but that didn't stop us from becoming pan-India. So we have now created pockets where we have our representatives, possibly not on our direct payroll, but they are there to serve any issue that lands up at the customer. Because this is something that we at Microgo very much believe, that even if the customer has paid us a single rupee, obviously the transactions are not of a rupee, but even if they have paid us a single rupee, we are obliged to serve them. So even if we place a machine there, we will first ensure, do we have a service backup there? Like for example, we have installations in Leh Ladakh. We have gone up till there and we have like around 15 to 20 installations there. But we have one person there who, if there are any sort of service issue comes up, he kind of is able to serve the customer. So yeah, that's the team that we
have. Thank you, Rachna. That's the right spirit to say. And where did you start off? How did you get the finances to start? Because I'd say I'm asking these questions from the point of view of somebody who's already in academics and wants to make this transition. Yes. And a follow-up to that would be, how did you ensure your financial health?
Yes.
I mean, you were working at BRC, but if it is somebody else,
yes,
do you have any tips?
Yes. So I would obviously suggest to start bootstrapping it, right? Okay. Why do you bootstrap it? Remember,
maybe you can explain a bit of it because the audience are students.
Yes, bootstrap is something that you start the company with your own money. You put in some of your own money. There are two reasons to it. One, remember, we are not a company which will just work. If you're working in a biotech, background, or if you're working in science, you really need, that the gestation period, gestation as in by the time the product will reach to the market will be longer, right? It is just not going to happen next day because there will be a lot of research, there will be trial, and I already explained you the product development stage, right? So because of that, the people, I mean, the revenue will not start immediately. It will take time. Now, if anybody who invests in the company obviously invests in for the returns, it could be any investor who comes on board. Even if my father has to invest in company, he will obviously see that will you return my money more than 12%, or otherwise I'll put it in an FD, or I'll do a mutual fund, or I'm risking the money that I'm putting it on you, right? Or in your venture. So it is important that if your money is involved, at least you have convinced that person, you have already built something. You're just not talking an idea. Putting your money talks two things. You know that you have your entire conviction in it, because otherwise you will not put in your own money, right? And then when you have done something and when you go to the person, you say, look, I'm not coming in as an idea. I've come with a small product and I have this 10 people who have already agreed. Possibly that person knows that, hey, you are at a very early stage. But when he sees that conviction of yours, your friends and family, that's the first round. First, it is going to be you, and then it's friends and family, and then possibly an angel investor who has enough money, but who is not looking at, lots of returns, but he's actually initially vested. Good for us. India has an extremely good ecosystem now that supports these sort of ventures. Government of India, Startup India, MITI, DBT, DST, BIRAC, or other small incubators. There are TBIs, there are sort of business incubators. They all come with small funding as well. But if I would, first of all, it is my personal opinion that I would start with something, even if it is as low as 50,000. But that defines a lot, and it actually brings that lot of discipline when my own money is involved. And it also brings a lot of trust among the people whom I'm asking, to put in money in my venture. So that's how we did. If you look at our financials, we definitely were bootstrapped. Then we had an angel investment. Then Department of Biotechnology's one arm, which is called BIRAC. They came in with one grant for us. And then we have won a couple of awards, as helped them us in financials. And somehow, I come from a science background. I may be a Gujarati, but not that all Gujaratis are great business or great entrepreneurs, right? I may have a great scientific possibly, but I don't know how to run business. So from second year onwards, we had decided that we are going to ensure that at least one salary or one rent or one component of the company is earned by revenue. Very small service. What that happened is that brought in a lot of mindset for entrepreneur, because as I told you, it's not about idea. It's about how you execute the idea. How do you talk to the customers? How do you understand their pain points? How do you are managing your expenses? That only comes when you're really, going out there in the field and trying to earn something. So that's exactly what we have been trying to do. And
so as a follow-up to that, one of the students, Soundarya, asks, inspiring talk. She says it's an inspiring talk, ma'am. How did you compete, being from a science field, how did you compete with giant companies? And, where did you, or how did you learn marketing?
So that's where, we are still not there. We are not competing with any giant companies. We are still not there. But as I kept on repeating, I think this is the fourth time I'm repeating this, anchor customers. Now, these customers, if you serve them with enough grit, with enough discipline, with enough persistence, they will only help you to get other customers. They will help you with getting problems that are so relevant for them that if you go and give them a solution tomorrow, they will pay money and buy it from you. And then that cycle starts and your finances are solved. You may not require the funding. Obviously, if you want to scale rapidly, you may require, but you want to grow organically, these customers will only help and do that marketing for you. You don't need to do any marketing. Personally, for me, I love talking. Any day, ask me if I have to be in the office or if I have to go out there. For me, any day, that is a great day, because I just love talk to them. Because it's all about, you get to know so many new people, you make friendships every day, you have a 10 new number being added, and daily you get to know new things. Like as a scientist, frankly, this is my observation. As a scientist, when you go and talk to a common man, initially he's talking about his problem in the company, but slowly it start deflecting to his personal problem. My water is issue there. My cousin had got infection. Can you tell me what should I do? That rapport start, and then he becomes your marketeer actually. He starts talking about you, your product, because frankly, in the initial years of the company, you are only the brand ambassador. You don't have those marketing budgets, you don't have those PRs, you don't have those advertisement money. So
again, there is a follow-up to that. This is from the YouTube. Subramaniam Rajagopalan asks, how do we enthuse a student towards entrepreneurship, and how does a science student know when an idea, its time has come?
See, we can take question one by one. What was the first question?
How do you enthuse a student?
I feel, let them hear these sort of talks, because after a point, it is such a hard game. If one is trying to pressurize or trying to push them, possibly they'll fail. It has to be a natural way. They really want it, and they want to do it for the right reasons. They don't want to do it for the money, because then they'll get tired. They really have insane amount of faith on the idea, because hardships will come, guaranteed problems will come. But if they love their idea, even if it is taking 5 years, or even if it is taking 500 calls a day to convince the customer that, hey, look, this is the right solution, you really need to have that grit. So I believe, let them see these sort of, let them go to most platforms like these, like let them follow. There are a lot of online things available. Please reach out to institutions like BIRAC and BBT and DSO, Startup India for that matter. Ask them to come and do this sort of more and more interactions. And once one student actually proves there is a success story of the department of one student, immediately he will become the brand ambassador for the entire process for the subsequent students. And what is the second question?
The second one was, when does a student of science know that the time is right for their idea to be implemented as a product?
Yeah. See, that I don't think the time is a challenge. The idea is the challenge. What is that idea which he has actually gone to 10 people, or maybe 100 people for that matter, spoken to 10 people, and out of the 10 people, at least 70 people told him that, yes, your idea is great, and I will pay money for that if you solve me that problem. If I see this mouse is not working well, and I have this, mouse which works like this, and if he said, yes, I'll sell you, and will you buy this mouse for me? Obviously, that person has the knowledge of what is available. And if he says, yes, I'll buy this mouse from you, I believe that's an idea that is worth pursuing. Right?
Fair enough. So just put it out is what you're saying. I don't know if this question is really relevant to this talk, but I'll just pose it to you. You can choose to answer. Abhinav Chaudhary. What is quantum biology, and what would be its real life applications?
Right.
Yeah. So there are quite a few very appreciative comments on YouTube. Maumita Mehti says, "Dear Rachna, congratulations on an excellent talk. That indeed portrays your journey as an entrepreneur. You're an achiever, and I believe that many students who cannot think beyond the traditional engagement / job will be encouraged to become entrepreneurs," which I think is true. This is a very interesting talk in that sense. Bhanumati Vishweshwaran says, absolutely self-inspired, and it's extremely convincing and confidence creating. So, these were the main questions. I'm just going to see if there's anybody from our audience here who would like to. Yes, Vandana, please go ahead.
Yes, really, really very nice talk, and very illuminating. I'm sure this is going to go a long way to inspire the others. The question which I have is, since you talked about the hygiene products, this is also applicable to some of the medical products, right? It's the confidence building in the people. Usually the Indian mentality is, if I pay more for something, it is generally good. That's the general mentality, even while buying medicines and so on. So have you encountered that kind of a problem, and how did you work around it?
I'll tell you a real life example. Real life in a way, real micro example. So when you look at the first wave and the second wave of pandemic, right, things were very different in businesses. During the first wave of the pandemic, the businesses were relying on the previous financial year. right? So they had enough cash to buy products, buy services, even if they were for hygiene, right? Because without hygiene, these days businesses will not work, but they had enough cash. Cut to wave number 2, the previous financial year was so bad that absolutely they didn't have cash, right? They want hygiene services, but obviously they can't pay, even if your product is doing everything that the product requires, but they don't have the money. That's when we as an companies also innovated on not always solving their problem, but also try to turn around that how our products will solve their financial problems. So we actually changed our revenue model. We also changed how we, reach the customers, how we price the customers, and we create different models to ensure that we serve the customers to, to the need that they need. So that's where I mentioned once that as an entrepreneur, you not only solve the typical problem that hygiene problem, for example, but you also solve the problem around the businesses are, having, and try and solve it and, give them to the customer. So you kind of constantly innovate, pivot, but not pivot to a different line, but constantly try and do newer things and check and balance and try to just keep at it. Just don't lose it. So yeah, that's how it is.
It's an ideal line if you want to keep doing something new all the time.
Innovate. Yes, you have to innovate. Not only in your ideas, you have to innovate in every possible way. I, as an CEO of my company, I have to innovate how I talk to my team. I learn on it. I was not a born CEO, right? I also, was a scientist and then became a founder. In fact, 6 months back only, I've started putting the word CEO. Till that time, I was only the founder. Then I understood what is actually my job. It's not only selling, it's also product. It is also motivating the team, ensuring that all the ways my team was, we have never stopped working. We have always worked in all the times. My team traveled, they came, they served, they did everything possible. And I kept on innovating, like that. How do I keep my team motivated? Obviously, by coming every day myself, but also ensuring that my team came, even though they were scared, their families were scared. You going, and we were working with ICUs, we going to ICUs, there were so many things, but then we all started to innovate. They started to understand what is the actual purpose of this company. And when they realized, then it was kind of, but then yes, constant innovation is needed in every facet of entrepreneurship. Yeah.
There is one question on YouTube, which I think even I would like to ask you. Do you have any internships, especially for young women physicists in your company?
Yes, we do have. I'm not sure how much you want to come in as an intern, and this times, but my email address is still there. I mean, they'll be flashing it out. Please write to us. And if there's anything that we can help you out or help you to decide whether you want to, in fact, like one gentleman asked us, right, that how do we enthuse the participant? Actually go and work in a startup. Do an internship. In fact, colleges now should have this internships not only in other research labs. Obviously, they send to bigger companies, but don't send in bigger companies, send to smaller companies like ours. Because in smaller companies like ours, in the early companies, we do everything. It's like we don't have roles that she does only this and he does only this. We do everything. We initial days, obviously, now we have little more standardized, but we do kind of everything. So possibly that's when you will start getting more intrigued, and your internship may lead to possibly an entrepreneur himself or herself. Yeah.
So she will write to you about all this.
Yes.
Vandana, I think there are no further questions. It's just a comment saying, yes, this is a real life experience of any entrepreneur, Prashanta Kundu.
Yeah, and I was just typing in.
Are there any other questions from the audience here? Would anybody like to unmute and ask directly? Okay, if not, I would like to, on behalf of CUTN, thank IPA and Vandana for giving us the opportunity to host this event today, and to Rachna for giving this really inspiring talk, because I'm sure many of our young students would be motivated to take up entrepreneurship in the longer run, and we need to be hearing more of these success stories. So on behalf of the department, I would like to thank all of you and the audience for being here with us today, and Vandana, back to you.
Thank you, Madhurima. Thank you, Dr. Rachna, for really for this wonderfully inspiring talk. And on behalf of IPA, I thank once again the CUTN for hosting this talk readily. And we are really happy to reach out to students. As suggested by Rachna, I have put in the general email address and their website address also. So I hope a few examples will now come in a few years down the line from there in the audience. So thanks once again for this really nice interaction, Dr. Rachna, and we look forward to many interactions with IPA in future. And also we look forward to active involvement from CUTN in the IPA events. In the meantime, stay safe and everybody take care. So thank you so much.
Thank you, everyone. Thank you.